Melon. Nice to meet you all. I'm Vice-President Yoon of Atomy. Nice to meet you and thank you for the warm welcome. Hey, actually, a lot of you, I think, more than half, are in this group. So I would like to start by saying this. So have you learned about, do you know what is, have you managed your blood sugar today? Blood sugar level shouldn't be that low, too low or too high. So while you're on the highway, you should be on lane. You should not hit on the guardrail or should be off the track. But inside that highway, you should smoothly be on track and be enrich the cell and control the blood level. So the blood level cut reach the aim. It goes through the vein. The blood sugar goes. Actually, there are a lot that damages the vein. So how we manage the blood sugar is important. If we cannot manage this and reach high blood sugar level, then it's just like a car going through a highway with too many cars. That a highway, what happens to the highway? It gets jammed. So if the blood sugar is too high, then all the organs that reach the blood glucose, it's so if it's stuck on the brain, that it makes cerebral cardiovascular disease, and it also can create a heart attack, and there will be times if it happens to the what if it happens to it gets jammed at the feet, then the foot starts to rot. That will have to cut off the foot. So these are the things that happen when there is high blood sugar level. As it gets stuck on that specific organ, it will cause trouble. So that's why we have to maintain this at this certain level. I'm not sure if I can say this, but do you know what happens if it gets stuck at the men's precious part? Then serious things will happen. Of course, the function itself will decrease. That's why it causes a lot of concerns. And were people who say that the certain because those people with high blood pressure, if you look into the statistics, those among above 65, there are more than 20 million people. So about 25 to 30 million people has this kind of problem, including all the people, more than 25%, or which means that more than half of the populations above 65 has this problem. Why does the blood sugar level rise at the age of 65? Because all the hormone functions start to plummet. Why the problem is not that solved? The base metabolism different from that of when you were young and when you're at the age after 65. That's why you have to decrease the amount you eat as you age. If you eat the same as you were young, then there will be a problem. There are lots of reasons why blood pressure rise. That might be your daily habits, or it might be because of our decrease in functions of the body. But this function decrease is there might be genetic problems, such as the kidney functional. Some of these can be solved by our effort, as it's seen at the last part of the slide. There are things that can be solved just by eating the lactic acid. So the decrease of functions can be solved a bit by our effort, but those functions that fall, such as the kidney, is not what we can do. If we intake sugar, there are two substances that aligns all the blood sugars in the middle of the highway. That's insulin and glucagon. You can see the green line, right? So inside this green zone, the blood sugar level should be at this green zone. So this width is about 70 to 100 when you're not eating anything, or to from 70 to 140, this highway should be kept. But if it goes above 140, that shouldn't be it, and it shouldn't go below 70. So if it goes higher than 140, the insulin will will press you down, and if it goes too low, then the glucagon will push you up, so that the highway is stably kept. So that's the functions. So this is important. So if you look at the picture, the pancreas, there is an alpha cell that is created, and there's beta cell. Alpha has to do with the glucagon, and beta has to do with the insulin. So they are the ones that control the blood sugar level. So among the Atomy products, there's one product that's controls the blood sugar, another product, that's Panaba. Then what does the Panaba do? Panaba from the small intestine lessens absorbance of the blood sugar. So at the small intestine, it should send the blood sugar to liver, but the original flow system from the small intestine, we reduce the amount of absorptions of the blood sugar. Then how about the liver? How are we to control the liver? We make the blood sugar, we spread. If there's too much, then we also make the neutral fat. What I want to talk related to this is a product that Atomy makes. There's something called blood sugar spike. Blood sugar spike is a bad pattern that humans have. So the blood sugar spikes when you eat something, then it creates too much insulin, thinking that the highway should be kept. Because there's too much blood sugar, it can hit the guardrail. Then if it hits the guardrail, then the glucagon will do its role of making the blood sugar so that the car will come back to track from hitting the guardrails. Then if it tries to go through the center line and then drive over the center line, then the insulin will do its job to keep the car on track. So if you look at the graph, the spike is, there's people that with the graph of hitting the blood sugar spike, and there's ones that have Dole's flat line. So the one with the big curves, and the ones who go just straight. If we compare their average blood sugar level, it's the same. 0 plus 10 equals 10. Divided by 2, it's 5. However, 0, 10, 0, 10, 0, 10, the one that fluctuates this much, but the one that just goes with just 5, do you think it's the same or not? The average is the same. So the blood sugar spike, people are not really aware of this. We have to control this, but people really don't know this. There are people who think that if that level goes a little bit high, they will tell you that you're reaching a certain dangerous level, so keep your blood sugar. That's all they will say. So carefully think about this. After eating, if you feel tired all of a sudden, and if after you eat, you feel sleepy. After you eat, after 1 or 2 hours, you crave for something more. These kind of people are the ones with the fluctuating blood sugar level. So if you think so, then maybe I recommend you, or it's best to, check your blood sugar level for 24 hours at a hospital. So there are people with a high blood sugar level, or there are people who had a heart attack even though he did not have any disease at the back. But if we look into the history of his health at the past, then there are a lot of cases that they had a lot of blood sugar spike. So maybe this blood sugar spike, it would be something to drive into death as well. So insulin and glucagon is what tries to prevent from blood sugar to rapidly go up. So all we have to do is regularly exercise and quit smoking and have a lot of sleep. This is hard. I know it's even hard for me. Number one, regular diet. This is hard. We should go easy on the carbs, the vegetarian vegetables, and we should eat the carbs at the last.
First, the blood sugar level could spike. You need to chew for a long time. While you are chewing, amylase could be secreted and insulin could be secreted and wait for them. In that way, you could keep the blood sugar level lower. And for the busy people, it is really hard to chew for a long period of time. When I work at the hospital, most of the doctor eat really fast. Do you know the average time? It is only 5 minutes. In 5 minutes, we eat all because we need to see the patients, and the next patient will come at 1 p.m. And then if we finish the morning session, we only have 30 minutes, so that we need to eat fast, and then we need to brush our teeth for 5 minutes, and we need to wait for the next patient. Because all of this, we have no choice but to eat fast. Although we know that we need to chew slowly, we need to chew for a long period of time, we know that we already got the information, but it is really difficult to do it in a reality. We all know that like excessive eating is not good. We need to exercise more and we need to do it. We all know. So it is kind of must. But in a reality, it is really difficult, but we could help you with the product. That is Atomy blood sugar called Beetle Melon. Conducted a lot of tests with beetle melon, and we could find out that the blood sugar level decreased by 10. Example, in an empty stomach, the blood sugar level is about 100, and after eating it go up to 110, and after eating a bitter melon, it decreased to 90. And glucagon, I mentioned earlier, could prevent the insulin working because glucagon create a lot of glucose, so it could decrease this level. But bitter melon could help it. Imagine that we are running on the highway and it could help us to take the right tour and right the direction. This is the role of the bitter melon. When you take some kind of health functional food, if that product make your blood sugar level decrease rapidly, you don't need to feel really happy about it, because a dramatic drop could be another issue. But beetle melon will manage the blood level in a proper manner. As a doctor, I need to be straightforward, and I would like to tell you that there might be some side effect of the bitter melon, so we need to minimize the side effect of bitter melon. Sometimes in an emergency room, there are some people who have the higher liver level due to the bitter melon, and I asked, what did you eat? And they said, I ate the bitter melon because I heard that it is good for the blood level. What is important is that you shouldn't eat the ripe bitter melon, but there are young bitter melons, and you could take it, you could intake it. So when we develop this product, we only use the young, unripe melon. When you make your own product, please avoid using a ripe bitter melon because it could have some toxic material in it. So we only use the young bitter melon in which seeds have not been formed. By doing so, we could decrease the secretion of the glucose, and it could increase the antioxidant material, and we also got the patent in it. And here there are other ingredients such as vitamin B, vitamin B6, and 12, and those vitamins are good for the diabetes patients. Because if the blood sugar level is high, homocysteine could be secreted and it could destroy your blood vessels. But this product, vitamin B and B6 and 12, could protect it from you. And there is adenosine, which is antioxidant ingredient. And other than that, a lot of good ingredients are also contained in this product. If you want to know more about it, please come to Soso class in the first week of August. I will give you more details in that seminar. I would like to welcome you all to Soso class. Also talked about the product Banaba, and you might ask me, can I tag both of them together? First, Banaba could prevent the absorption of the glucose in the small intestine, and bitter melon could prevent glucose from being secreted from our liver. Banaba facilitate the glucose being metabolized in a lot of organs. So in order to, when you take banaba, you need to do some exercise in order to maximize the effect. Then what about bitter melon? Banaba facilitates insulin that it decreases the possibility of the insulin resistance so that it could reduce the blood sugar level. So when you combine both of them, it's the best. Please take banaba and the bitter melon product together and it will maximize the effect. But for the pregnant women, you shouldn't eat bitter melon. I don't recommend pregnant women to take bitter melon. And for the one who don't have a good kidney, stop. Please don't take bitter melon. So those people are the exception, and other than that, all of the people could take bitter melon product. But sometimes, really, see some patients with a high liver level as they eat a ripe bitter melon. But I assume that our product might be okay. But if you are really sensitive about that, please be careful. Banaba and bitter melon products are really good for the pre-diabetes patients. It could be maximizing the effect and it will help you run on the highway and it will help your smooth operation in the blood vessels. Once again, on 23rd, this product will be launched. I would like you to love this product a lot and I would like you to have much effect from this product. Thank you very much.